Good afternoon, everybody. My name is Lawrence Stuntz. I'm the director of the Massachusetts eHealth Institute at the Mass Tech Collaborative, and I'm so pleased to welcome you all to today's inaugural Innovations in Caregiving webinar, and the first in the series, where today we're going to be talking about COVID, caregiving intensity, and the impact that the two of them have on mental health. We have, both that as well as what organizations can do about it. So we've got a great panel today. We've got data, we've got stories, and we've got innovation to talk about here. So without further ado, to kick it off, I'm going to introduce Carolyn Kirk. Carolyn is the executive director of the Mass Tech Collaborative and my boss. Carolyn, welcome.
Thanks, Lawrence. Really happy to be here. Thank you for the introduction, as well as to our panelists, the speakers, the operations staff who make the webinar possible. And I want to thank everyone in attendance. It is going to be a super discussion. And as the executive director of the Mass Tech Collaborative, I'm delighted to kick off this innovation webinar series, as well as to let everyone know about a new caregiving initiative at Mass Tech. And before I do that, I just want to talk a little bit about Mass Tech and do a quick introduction of who we are. And we are a state agency, and we're charged with strengthening competitiveness in tech and innovation. We do that through investments, partnership, and harnessing talent, and across a number of areas. In the Innovation Institute, we focus on cluster growth, and that's what is next coming around the bend in the economy. In the Center for Advanced Manufacturing, we focus on jobs in manufacturing and career pathways. And these next three areas, my gosh, the pandemic has really exposed the challenges and the opportunities here. Broadband, as we work from home, as we learn from home, as we do our telehealth from home. Internet is so important. Digital health, telehealth, caregiving, cybersecurity, protecting everything that we're doing online and protecting our data. Those are some of the other divisions that we work with. So let's just jump to within the Mass digital health area under MIHI that Lawrence leads. We're kicking off today the Mass Caregiving Initiative. And I'm going to just take a minute and focus on our logo here. And it's signified by a labyrinth. And that's what this symbol is of the sea. And sometimes people get confused between the difference between a maze and a labyrinth. A maze is frustrating. It has dead ends. It has trick pathways. But a labyrinth is very intentional. It has one path in towards the center and one path out. In fact, some healthcare organizations are building labyrinth gardens on their grounds as ways to reduce stress. And we believe that the labyrinth is a symbol of what our intention is with a caregiving initiative, is how can we support our employers and our caregivers and our communities with innovation in order to have a smoother path, not have caregiving be a maze and confusing, but really to have it be an intentional journey for doing the job that we are all so trying to do. So the Caregiving Initiative will focus in these three areas. And as you know, in 2019, this initiative was kicked off on the employer side with the Mass Business Roundtable. And that was the Massachusetts Caregiver Coalition. And we really proved out the concept that this work is really important for employers. And it is a bottom line, top line issue. But we also need to focus on our communities. And we have with us today, Robin Lipson, who you will hear from later. And we are partnering with the Executive Office of Elder Affairs in order to figure out ways to better support our communities. And then again, in the real sweet spot of Mass Tech, how do we bring innovation into the picture and support our caregivers and our employers and our communities? And we're really excited to hear about some of the thoughts and ideas that folks have here today. So that is really what, that's a really ambitious agenda. It's a very high level. And I just wanted to reveal the big picture of this. But it's my great pleasure today, right now, to introduce Alexandra Drane. Alexandra is the CEO and co-founder of ARCHANGELS. And gosh, she has done more to expose all of us to the needs of caregiving and caregivers. And she drives us to do better and be better and strive harder. And you know, I just can't say enough about my adoration for Alexandra Drane. So Alex, over to you.
Oh, right back at you. I have been a fierce advocate, passionate, almost rabid supporter of all things Mass Tech Collaborative for a long time. And you know, Carolyn, with your background, you are uniquely positioned to be doing exactly what you're doing, crossing every aisle, breaking every silo, and driving the impact that you are. So enormous appreciation to you. Thank you. And how incredible that we're here. To me, that was the first time I'm seeing the logo also. The big reveal, it's freaking awesome. I love it. I think it so embodies what we're doing. We're not a maze, we're a labyrinth. And I think hope, let that be an under sort of flow of everything we're talking about today, because being a caregiver has a lot of glorious, beautiful parts about it, right? There is a beginning, there is a middle, there's ways we can support you through it. And I love that feeling of hope that is in the labyrinth and calm. So thank you for introducing it that way. I'm going to call up Chuck Czeisler. Chuck, coming up. We are so excited to have you here today for so many reasons. And so everybody watching, we're going to start by talking about some of this data with Chuck. For those of you who don't know, Chuck, I would describe you as very important in a lot of ways. Historically, you've been known for the innovation that you've brought to the sleep world, the data, the massive amounts of data and impact. You are I'll talk formally about you first. You're the Baldino Professor of Sleep Medicine and the Director of the Division of Sleep Medicine at Harvard Medical School, and you're the Chief of the Division of Sleep and Circadian Disorders Department of Medicine and Neurology at Brigham and Women's. And that is very impressive, but I'm going to, right now, I'm going on record as saying, I think soon you're also going to be famous in the caregiver space. And I'm so excited about that. And everybody watching should be as well. And yes, as it relates to sleep, we know caregivers get less sleep, but also much more broadly. And I think that's why we're here today, that vision that Carolyn just laid out about this is something that goes all the way out from employers to community individuals, mandates, the requirement of innovation. And in the interest of full disclosure, you and I have worked together now for over 10 years. It was historically around sleep, but our caregiving love connection, that's what I'm going to call it, came from that sleep work. You reached out about some research you were involved with that Mark Czeisler was spearheading, and that is where this all began. So that is where I'm going to start. I am so grateful that we're talking about innovation as it relates to caregiving, specifically the unpaid caregiver. Tell a little bit about our first conversation on this topic. What about that was innovative?
Well, you opened our eyes to the whole issue of caregiving, because when Mark and I were working on this, he had a Fulbright scholarship that was cut short by the pandemic, came back and said that he wanted to work on issues related to the impact of the pandemic on sleep and sleep disorders. And so we were busy doing that. I contacted you about the issue, and you said, what about caregivers? And my first reaction was, because everyone we talked with, by then we were working with the CDC, which was very excited about the surveillance data that we were collecting. Because the CDC could not act as quickly. I mean, we had nationally representative samples, questions going out in March and April. And it takes 6 months to get approval from the Paperwork Reduction Act to ask a question. So they were like, oh, you're able to ask questions? Can we? So they were flooding us with questions about hand hygiene, school starts, impact, attitudes, behaviors, and beliefs about the mitigation strategy of the pandemic. And so and I was really concerned about the burden, the participant burden, adding more questions. So when you said, oh, this sounds exciting, but can you look at caregivers? I was like,
we had a fight.
yeah, we had a little bit of a tiff there. But anyone who knows Alex knows that you're a force of nature. So, so Alex said, you know, we really got to look at this. And of course, I knew that many people with cognitive impairment, like Alzheimer's disease, that the thing that propels them to institutionalization is when the caregiver can no longer cope with their sleep disturbance at night, sundowning and other things. And now the caregiver's job is imperiled by that because they can't sleep at night and so on. So it was an area that I thought, okay, we'll dive in on that. And you had this wonderful Caregiver Intensity Index, which we could fold into the questionnaire. But then when we distributed the first survey, really the results knocked my socks off because, I mean, we were not prepared to have this be the issue that really was one of the strongest predictors of an adverse mental health consequence. Yeah. So just to give you an idea, you know, we had non-caregivers, as assessed by their Caregiver Intensity Index, non-caregivers had 3.6% of them reported thinking about killing themselves in the previous month, whereas more than 30%, the prevalence factor is more than 8. 30%, more than 30% of the unpaid caregivers reported that they had seriously considered killing themselves in the prior 30 days. And similarly for anxiety, depression, substance use, increased use of substances to cope with pandemic-related stress, 6% in the non-caregiver population and 33% in the caregiver population. So these were just startlingly, and the CDC was kind of unprepared for this because they said, you know, we've never looked at caregivers before. And so suddenly we're publishing an article in their main publication, Morbidity and Mortality Weekly Reports, and we're highlighting caregivers as a particularly vulnerable group. And that's all because of your initiative, this innovative look. And, you know, if you don't do the surveillance, I've come to realize, if you don't ask these questions, if employers don't ask these questions of their employees, they have no idea what's going on beneath the surface.
Yeah, no, it's so true. You know, I want to go over some of those stats again really quickly. So a full 56% of this unpaid caregiver population had anxiety or depression. So 2.5% rate of the rest.
More than half, yes.
For a second, also on that substance use. So 5 times the rate of increasing the use of substance use. And anyone who's listening right now who's been an unpaid caregiver, you know, sometimes what do? You self-medicate, right? The answer is at the bottom of a glass. If you're lucky enough to be able to do that, you might actually be self-medicating. But then I think what's so extraordinary, let's go back to that suicidal ideation statistic. So what is the ultimate manifestation of feeling at the end of your ropes is contemplating suicide. And that number you said, so it was 10 times the rate for unpaid caregivers are contemplating. Yes. One in 3. And even when we adjust for all the other factors, because, you know, the first, we see that it's 10 times the rate, then we adjust for age, ethnicity, work hours, and many different other factors. When we adjust for all of those things, it's still an 8.6-fold increased risk. So these are, you know, usually you talk about something that is a 30% higher risk. You don't talk about something that's a 750% higher risk. I mean, these are just crazy numbers. Yeah, no, I think that was we have a weekly conversation every Tuesday at 15. We get together with the research team. And I think what was so amazing in the early days was, you know, we sort of didn't believe the data, even though we knew the data. We're all like, is that really that extreme? And it was really that extreme. So, you know, I'm going to explain quickly what the Caregiver Intensity Index is, because there's some more data points I can give as it relates to that. It really is sort of this great global measure of how caregivers are experiencing their role, really the intensity and what's driving that intensity. You get a score from 0 to 100. You can look at the population basis. You can also look across these dimensions. And intensity can be spread. You and I, Chuck, have talked many times about family conflict as a driver of stress, right? And how that can drive it. I just want to give you some things. High intensity caregivers, 54% of high intensity caregivers seriously considered suicide in those 30 days before we advanced to this. And that's 15 times the rate of caregivers. So overall, it's 10 times the rate, but by the time you're in a place where you're feeling high intensity, it was 15 times. Were there other things, like, for example, the data around who was accessing support? We're on the phone with hopefully a bunch of employers who were considering whether or not to start looking at supporting this population and how to support this population. Share what was surprising there.
Well, there were two things that were really surprising. So first, the first thing we went to zero in on was, is this just a very rare group? Are we talking about 0.5% of the population who are caregivers who are in this extreme category? But when we looked at the data, it's 1 out of 4 employed people. So it's not a tiny fraction of the workforce. And that group, a substantial fraction of the workforce, has this incredibly increased mental health burden. The second thing that we thought, well, because we assessed whether they were seeking help from their employer assistance plans. And we thought those who are getting the help, maybe they're doing better. But actually they're doing substantially worse, which is an indicator to us. I mean, it's just like when you look at fall asleep crashes fatal to the driver, truck crashes. Those who are in sleep-related fatal to the driver crashes have dramatically higher caffeine levels in their bloodstream. So you're left with trying to understand, is that because the caffeine is making them have a sleep-related crash? No, the caffeine is a marker that they are severely sleep deprived and they're doing what they can to cope with it. Similarly, among the caregivers, going to the employer, they only do that as a last resort, it would appear. That's our hypothesis as to why those who are seeking that support are worse off. And so that tells us that we really need to make it more normative. We really need businesses to tell their employees, that everybody is trying to care for, and particularly if they're multi-generational caregivers, caring for adults as well as caring for children. Those people are incredibly at higher risk. And so it would be great if employers, because everybody thinks that they're the only one with this problem. They have a particular adult that they're caring for, and maybe it's a difficult situation. Maybe they're having some family stresses. Who's going to care for them? Maybe the adult is not complying with any of the COVID, mitigation strategies, and they get sick, and the caregiver feels guilty. Maybe the caregiver, maybe someone in the family got them sick. There's so many different things that you can read about in the newspaper or in case reports, and that could make things very stressful. So I think it's important for employers to convey to their employees that we know this is difficult, to do some surveillance, identify the caregivers, and say, you don't even have to ask us. These are the things that we can help you with.
Yeah, I'm reminded a lot, and Anna's coming on and Robin a little bit, and they're going to be talking about the work that they're doing with caregivers. And obviously this is often hand in hand with advanced illness. And we've learned in working with advanced illness over the years that the wrong time to have a conversation about somebody's wishes is at the last minute. And I think for employers, the wrong time to support a caregiver is at the last minute, because by then it's too late. And we know that a huge percentage of employees right now are leaving the workforce. Why does the Mass Caregiver Initiative include community? Because if you're only focusing on employers, you're not paying attention to all of those caregivers who've had to reduce their hours or leave the workforce altogether, or who in fact never even came into the workforce, because they're 1 in 5 caregivers who are Gen Z. And we know in these multi-generational households, often that's the person who's told, you're not starting work, you're here to take care of grandma, uncle, whatever it might be.
Unfortunately, this is setting back, women going into the workforce. Unfortunately, these burdens are often disproportionately felt by women in the household. And so they're losing the strides that they have gained in the workforce by having to reduce hours and or drop out.
Well, one of the other findings we had from the second study that was published was around people. We know that before COVID, unpaid caregivers were called high flyers, in that they were, are you guys having trouble hearing me, by the way?
No.
Okay, good. They were called high flyers, in that they were overutilizers of the emergency room or urgent care, because they couldn't go to get regular care. as of COVID, and we used to think that was bad, right? All of our attention was like, let's help these high-flying caregivers get better support through the system in non-emergency based ways. Now, the second study that was extraordinary that you guys did showed, oh my gosh, now we'd rather have that back because now they're not going at all, right?
I mean, so we did, the CDC wanted us to look at an issue of delay or avoidance of necessary medical care. So we conducted a nationwide surveillance study to look at that issue. We found that there was a very high prevalence of people who didn't go to seek medical care, either routine medical care or emergent medical care. And again, we found that unpaid caregivers were avoiding urgent and emergency care at 5 times the rate, and regular care at 1.5 times the rate as people who were not caregivers. So we're talking about a 400% increased risk of avoiding or delaying urgent or emergency care among unpaid caregivers, probably because they just don't even have time to. You know, it's like, I don't have time to get sick.
Yeah. Or they're worried about getting to that point you made earlier. They're worried about getting their loved one sick. So if they go in, they catch and then they come back. So we also looked at some other populations, 18 to 24-year-old caregivers. I think it's fascinating the extent to which when we think about an unpaid caregiver, we think of a 46-year-old woman caring for her mom. And that's true, and she often is. But certainly even before COVID, but as of COVID, we're also seeing all of these out of order caregiving, it's called.
Right.
Folks who are sort of being pulled into this with no skill set, no support, and this feeling that they're incredibly alone. And, you know, when you talk about normalizing and destigmatizing, sometimes the most important treatment or line of care for an unpaid caregiver is just to know you're 1 in 4, you're 1 in 5. Right now, about 2/3 of us are in this role. Like, you're not alone in that. Were there other things like the essential workers component that stood out to you?
Yeah, I mean, with the young people, the 18 to 24-year-old caregivers, we found that more than 88% of them reported an adverse mental health symptom, which was 4.5 times the regular population. So again, you know, we have 350% increased risk of having an adverse mental health symptom in that group of 18 to 24-year-olds. And it's not a small fraction of them. It's almost 90% of them are experiencing this. So, and you know, you can think about, you know, why they should be experiencing so much more stress about this than the people over 65 who are caregivers. Maybe the people over 65 have had a long period of time to adjust to this, and maybe that's a slow transition, et cetera. But suddenly, you know, the 18-year-old who's, you know, thinking of going to college parties or whatever, suddenly is having to take care of an ill parent who maybe had been stricken down by the pandemic or whatever has happened that has destabilized the situation. And now they're thrust into a caregiving role. We still need to do more research to find out why it's so much worse in that group. But we also find Hispanic caregivers, they have, you know, almost 90% of them have experienced at least one adverse mental health or behavioral health symptom, versus 53% of non-Hispanic caregivers. Black caregivers also 80% versus 50% of white caregivers. And essential workers, again, have markedly increased risk if they're an essential worker and they're a caregiver. And the high intensity, you know, with your caregiver intensity index, we found that the high intensity caregivers who rated themselves as such on your questionnaire, they had a 15-fold increased prevalence of an adverse mental health consequence as opposed to those who were not caregivers.
Yeah. You know, one of the things, Chuck, you and I talked about a lot through the years is, and you've driven a lot of impact, a lot of action to impact by your work. And what we're hoping is this will get a lot of attention and start driving people to do innovative things to start trying to address these populations. Can you explain what the MMWR alt metrics rating is? I think it was like a popularity contest. Like
that's getting a little bit into the weeds, but the CDC, the Morbidity and Mortality Weekly Report, which is kind of a depressing name, is the CDC's main publication, their main journal. So when the CDC wants to get a message out For example, that's the journal that first alerted the nation to the risk of HIV infection and AIDS back in the day. So they get a case report, they get something, and they publish an article. And they can publish much more rapidly than the traditional medical journal process. It goes through about 60 different reviewers. It's an incredible thing, very exhausting, but they can do it quickly because when something is designated as a tier 1 issue, which this mental health thing was, the reviewers, instead of being able to lounge around and spend months looking it over, have 24 hours at each stage. So when it's designated by the CDC as a tier 1 issue.
Tell me what this rating was. I have
all
it.
right. So the altmetric score on our mental health paper is 6,500, which puts it in a very, that's basically the impact on, newspaper articles, Twitter, everything from the television programs. It had I think 4 articles in the Journal of the American Medical Association about it. It was cited in the presidential order the executive order to increase funding for mental health services. And there was this article cited. It was cited by the Lancet Commission on Mental Health. It was so many different, because this was sort of the first article to,
lay bare,
raise awareness about this issue. And so it really was, it's like in the top point, whatever small, of the 15 million publications that they have tracked. It's in an ethereal space. Oh, it's way better than top 5. It's like top 0.1% or something.
So everybody who's watching right now, if you're wondering, like, is there a massive tidal wave coming of awareness that this is a massive, massive, massive issue? Yeah, so you've got cover. You can go be innovative in the caregiving space because there is evidence and attention at the highest levels that this is something that really matters. So Chuck, I'm going to switch to our panel. Closing words, anything last that you want to add? Call to action for this audience.
Well, yeah, I do think that this is an important call to action. And I appreciate, Alex, the way that you've led this call to action and brought us together to do the research and to come up with these extraordinary findings, which I think should be a call to action to not just employers, but to the community in general, to support our caregivers. They're playing such an important role in our society, providing care that we simply can't provide in any other way.
Yeah. Chuck, I love you. And thank you for being such a champion in this space. And I do have enormous faith that eventually we're going to be looking at the impact of sleep for caregivers and be able to do stuff that employers can support as well. But when you bring the kind of credibility that you do to a topic like this, it helps all of us. So thank you, thank you, thank you. And you and I'll be in touch.
Thank you so much. I look forward to the rest of the symposium.
Thank you, Chuck. So I am going to call on, if that is okay, Anna and Robin. Anna and Robin, I feel like in the olden days, come on down. Hello, how are you? I'm gonna, first of all, how much do you love the new logo and how much do you love Chuck?
A lot to both.
There's a lot to love, right? I did not oversell Chuck Czeisler. He is extraordinary. So Anna, let me start with you. And I like to creep on you all the time, but in this case, I went and found your Twitter bio because I thought it's a kind of fun to look at how people self-describe. You are a self-described biologist turned science journalist turned health policy person turned serious illness care transformationalist. I love that. Your formal title is Executive Director at the Mass Coalition for Serious Illness Care, along with serving as Senior Director of Strategic Initiatives at Blue Cross of Mass. And Robin, you serve as Deputy Secretary at the Executive Office of Elder Affairs for the Commonwealth. And before we go any further, I just want to say, and this was all the buzz, and we were all hanging out in whatever you call the room before you go online, come online to the Zoom. Thank you, thank you, thank you. To you, to Secretary Terry Sutters, to your entire team, to Charlie Baker, to the entire administration. Thank you for what you announced yesterday, that caregivers of somebody over the age of 75 can now get the vaccine. And just in the room before, we were listening to examples of folks who are now elders who are getting the vaccine 2 to 3 weeks earlier than they would have, because now they get a caregiver who can go with them, who's willing to go with them because they're going to get the vaccine at the same time. My own mother-in-law, who I love madly, does not speak English. She only speaks Italian. And she's been reticent about the vaccine. now Antonio, and there's no way she can go, she can't get there by herself, and nobody understands her when she's there. So now Antonio's gonna be able to take her. He's gonna get his vaccine himself, which will make the whole household safer because we have kids and all that. So I just wanna say thank you, thank you. That was awesome. Thank you to everyone, very, very grateful. So Anna, I'm gonna start with you. You know this data inside and out. You have been living this for years. We had our first lunch about caregivers 7 years ago, which is insane. The need to support this population is so clear, right? The data is obvious. So I want to get very practical and tactile with you. It's 2021. How are you supporting this population right now?
Yeah, so down to details first, I'd say I think about it, we're sort of thinking about it in a couple of different buckets. Clearly, as an employer for our own employees, we have about 4,000 people who are employed by Blue Cross Blue Shield of Massachusetts. And I'm speaking with my Blue Cross Blue Shield hat on too, though obviously the serious illness world and the caregiver world, they I mean, is what brought me into this space to begin with, but I'm speaking from the plan side and the employer side for this portion of today. So I think about our employees, we think about obviously our members, the millions of members that we represent, as well as the caregivers of our members. And so for our employees, like starting in the pandemic back in the spring, it was about emergency backup childcare for both elder care and for children, and like getting to the point of actually direct payments to people so that they could pay their neighbor, their family, like whoever made sense from your bubble. It was also, we started at a certain point, probably in the spring, having bi-weekly mental health chats with two of our medical directors who are psychiatrists. Caregiving came up a lot, you will not be surprised. And we actually had two of those visits that were specifically focused on caregiving. One, a little bit more about parents staying home with their kids, and then another more about caregivers who are dealing with obviously adults 18 and over and their own aging parents often. And then I would say in terms of the members, we've always done like little bits and bobs here. There was sort of a cancer care program that had an emphasis on caregiving, but we've started looking at really targeted caregiver specific supports that are really kind of naming what it is, which is a caregiver, as opposed to kind of directing it more indirectly or adjacently to the caregiver. So those are about our nurses, our nurse care managers are on the phone with people's caregivers all the time. Like we are already talking to them all the time. So it's sort of like formalizing the way that we talk to them, focus on them, ask them for what they need, focusing on their needs, not just how to make them a better caregiver for our member, but really their needs as an individual. So that's sort of like, I mean, a couple of different pieces of soup, and then what we're really excited about, and I think one of the things that's exciting to be here is that all of those things kind of require caregivers to identify themselves as caregivers in one way or the other. It's great when we're on the phone with our caregivers of our members, but if we're wanting to get to the millions more who are actually our members who are caregivers, we can't see them in claims. We're not talking to them because they're too busy kind of doing like avoiding the care, so we wouldn't even see them. So I think we're really excited to be partnering with ARCHANGELS because we're thinking about this not just as employer, not just as a health plan, but also as a company that feels a big civic responsibility to the state of Massachusetts and how we're going to contribute to the wider culture change. So partnering with Alex, as you know, on a kind of a broader campaign that's trying to really understand how caregivers, what words to, like the best ways to sort of help them identify, and then potentially as part of that sort of pH change in getting people to recognize that they're a caregiver and reach out for support.
Yeah, it's funny. And I think the healthcare system has been slow overall to recognize the importance of language. And I think about the work that you did in your other role with the Serious Illness Coalition around the importance of language, and the language that you use matters. And I think Chuck did such a gorgeous job. You know, here's somebody heavily immersed in research talking about culture change and normalizing and destigmatizing, and that we're not going to get caregivers to raise their hands. It's unfathomable that by the only time someone's actually going to their employer to get help is because they're at the end of their rope and they're about to have to quit. And that's the moment that they actually do it. And I think that's so reinforcing of that point in the work that you're doing. Thank you. So Robin, you know, Carolyn introduced the Mass Caregiving Initiative earlier today. And again, I can't say enough how excited I am about it, because I think it gets at that, right? Which is if we're only focused on employers, we're missing a huge part of this population. And that broader definition of what care is, who's doing it, where it happens, and how to therefore support it, we're not going to make any change that's, you know, going to be lasting, foundational, unless we take that broader view. So let's talk about your role. So we're looking across communities, local, state, federal, support, policy, and creating solutions that work. You and I laugh, not laughing, like, haha, not funny, around if we're just focusing on one place, we're really squeezing a water balloon and not having the impact that we need to have. So you're wearing all of these hats in the role that you're playing. Talk to us about the innovation that you're bringing across that responsibility.
Okay, well, that's not a simple question. There are a lot of aspects to that answer. So let me start by saying I come at this kind of wearing three hats. My first hat is that I'm a caregiver myself. Just lost my father-in-law last week, but there remains my mother who's 91 and my mother-in-law who's 87. So I am deep into caregiving land myself. Second hat I wear is as a policymaker. The Executive Office of Elder Affairs, for those of you who may not know, is the state agency on aging, and our mission is to promote the independence and well-being of older adults in the community, which is where most people choose to age, and that would not be possible without family caregivers. And then my third hat really is as an employer. I have many people working for me, and I want them to stay working. So as I think about each of those three hats, I guess a couple of things I want to share with you. The first is in the policymaker role. I think it is very much our responsibility to lift up this issue and to make sure that the conversation about caregiving, or whatever cool words we want to give it, is happening at lots of different tables. This is something that should be part of every sector. It's part of life. It's something that many people experience, and they experience it differently, that there's no homogeneous caregiving experience. And so I think a big part of our work and where the innovation comes from is by lifting this up and making sure it's talked about everywhere, and that people understand it, that they can identify themselves as caregivers or as people who support caregivers. So that's kind of the first thing. As an employer, as I think about it, I really want people to keep working. And I can imagine for other business leaders who are engaged in these conversations, we don't want to lose our workforce. So that's selfish. But then when I think about the actual worker, for them, working is about their purpose. It's about their self-esteem. It's about their financial security. And for many workers, it is their source of respite, and it is their source of community. So I don't want any of that to go away. And so when I think about bringing all of those things together, and the very stunning data that you and Chuck shared, I think this is an all-out campaign to bring all the pieces together, and for everyone to approach this in unison, although with great local adaptations and variety to meet individual needs. So that's kind of an overview of how I think about it.
Yeah, I love that. It's interesting. You and I were speaking earlier about, and I know, Anna, we've had this conversation a million times. We're in an echo chamber in some sorts, and it's awesome that we all care about caregiving and working in the healthcare space, or anyone who's on this call. Thank you, thank you, thank you, thank you. Now go out and go grab 10 more people and get them, deputized into this role. You're at a utility company. There's a role there. If you're designing cars, how are you changing that based on caregivers? Merchandising, how are you changing what you're stocking on your shelves to be sensitive to what caregivers are looking for and how they're looking for it, and helping them feel less alone? I love, what did Gillette do? They made a razor, the first ever razor for you to shave somebody else. Like, anyone who wants to Google that, you will cry. I cry every single time. So Anna, you were the first one for me personally to sound the alarm. Archangels has always thought about the unpaid caregiver as somebody who's caring for somebody who's got advanced illness or a child with disabilities. And we really never considered the role of a parent. And COVID, boy, did they blow that wide open. I don't know, anyone didn't see this section in the New York Times. Paul, we should find this and stick it into the chat. Unbelievable. It laid out what, Anna, you explained to me about what you were hearing from your employees about what it was like to have a 2-year-old or a 4-year-old, as schools were closing and daycare was closing and adult daycare was closing, and the wit's end that people went to. So thank you for sounding the alarm for me personally before anyone else did. You've been working in this space for a long time. I'm going to say that means you're wise. It's why I love to use the word elder, not senior. And innovation is about failure on some level, right? It's about you try and you try and you try and you try. talk about some things, help us all make new mistakes. Talk to us about some of the things you guys are doing that have not worked, and let us learn with you from that.
I think that we were preparing for this, and I was talking with Alex before that, and reflecting on a lot of the sort of tries and the framing. I think one of the big takeaways that I have is that caregiving, and it sort of picks up on what Robin said, these sort of pieces coming together. It's sort of because of the way our healthcare system and frankly, like a society thinks about problems within the silos in which we all sit. Caregiving like cuts across these silos in this like unique way where I kept on just not finding a home for it. It was harder to find, like, it's a little bit about that person's, the caregiver's mental health and their medical spending. It's obviously a little bit about the health and the well-being and the safety of the person that they're caring for. It's a little bit an HR issue, and it sort of overlaps with our EAP programs. It's a little bit about community because there is so much sort of cultural component about it. And it's sort of, so it just sort of cuts across perfectly that even though everyone can recognize that it's like an issue, it was never on, because it sort of touches so many different facets of us as human beings, it was really difficult to like land it in the right place for us to get enough traction to go. And I would say that the pandemic has changed that in some really meaningful ways. And just like you were sort of foreshadowing with parents, I think that parents stuck at home with their children, all of a sudden, which became really universal for parents with school-age children one way or the other, I think it sort of brought out into the light the experience that caregivers of older adults and sort of disabled or children had been feeling all time. So it did start really normalizing some of that experience. And I think so much of the data that Chuck presented, like kind of zeroing in on the mental health crisis that it is creating, also has opened a lot of doors. But it is just about that fact that the way we create and think about solutions in the health space and in the social services space, caregiving was really falling in the cracks between the different ways that we think about people.
So Anna, just because we're supposed to tell stories too, tell the story of you in the meeting when you lost it.
No, it's not like I was by myself. So like, let's be clear. It was really trying to sort of think about the way in which like the place where I could find homes for this and partners and trying to kind of move this work forward. And like, I would literally I came back to my desk and I always say it's the closest I've gotten to crying, because it was just like hard to find the right place for us to think about moving forward. And we have all these initiatives, it's coming forward, it's like moving forward together. And maybe it's always this hard when you're trying to do something new. I always say the only thing that surprises me is that I keep on being surprised how hard it is to get things done. But yeah, it's tough. It seems like a uniquely challenging issue because of the way that it just doesn't fit neatly into any of the silos which we have created to support people in our health.
Which I think is so on innovation is to tell everyone that's listening right now. So be sensitive to that, and you're not alone in it. And now when you're going to your organization to try and affect change, remember that. And so be pulling together, because we know Mass Tech is about economic development. We're looking for top and bottom lines. We know there is an ROI. Carolyn Kirk, this is for you. We know there's a massive ROI in supporting caregivers at the community level, at the state level, at the employer level, at the health system level. And it could be that we just need to unsilo where people are looking at the impact of caregiving and look at it in this broader way, which, Robin, is a wonderful way to come back over to you. Chuck shared a lot of data that I think speaks to what you're experiencing firsthand across those different hats that you wear. And there's some data that you got from your own population that we can get into if that makes sense, or just some of the resources that you as an employer, but also you as a state, have available now to be supporting people.
So let me talk micro and macro here for a second. So micro, the data Alex was referring to, we did the Caregiver Intensity Index with our team at the Executive Office of Elder Affairs, and then with the Caregiver Support Specialist Network across Massachusetts, which are the people all over the state who actually have jobs specifically designed to support family caregivers. And I think, so these are largely subject matter experts doing this survey. They are people who know the answers to the hard questions. They know where the resources are. They really are the experts. And the big eye opener for me was the intensity level that these folks were experiencing in their own lives, not because they didn't know where to get help or how to aid or where there's a respite program, but because of all the other factors and burdens and challenges that caregivers feel. whether it's lack of time or family conflict or, you know, unclear decision making. And so for me, the big learning there was even the experts, even the people who you think are most equipped to manage these challenges really need support. So if we think about the employer setting and the workplace, we should assume that some large number, 1 in 4, for instance, are experiencing this phase in their life. And that even if they are a doctor or a nurse or a social worker, they likely need support that they may not be getting from their community. So that's kind of the big takeaway on that. On the macro level, I think so much of what Chuck shared, we see every day. It is unlikely that someone who is caring for someone else, maybe an older adult who has dementia or who has serious support needs, doesn't also have an accompanying challenge around their affect, how they're feeling, their own health. We see this every single day. And so for me, the light that these studies shine on these issues makes me want to make sure that all of the programs that are out there, that they work more closely together. So I want the home care programs to understand that the caregiver may be experiencing depression or anxiety or whatever it is they might be experiencing. And I want the caregiver support specialists and the folks supporting caregivers to understand what the person being taken care of might be experiencing. So I think it's really important to bring this all together in kind of a 360 way so that we can better approach and better find supports for people.
Yeah. And I think, you know, I know EOEA was one of the first groups I saw across all the states to have this one door approach, that if you call the phone number, and you can find it in a number of different ways, someone's going to stay with you on that phone call until they walk you over to something that's going to support them from a caregiver perspective. And everyone on that team is trained. And this is innovation that every employer and every health plan and every community clinic needs to be thinking about. You got to look for markers besides the word caregiver, because for a lot of folks, they don't know what that word is. So we're looking for other markers that can be your excuse to start this conversation and help somebody feel less alone in it first and foremost, but then say there's actually a bunch of resources that exist that most people don't know about.
Yeah, and we'll type those resources into the chat so that people have them. We also have a relationship with Mass Support, which is the phone line and resource center that is supporting folks with mental health needs related to COVID-19. And so that's another resource for folks as well.
Okay, Paul, if you'll, I get in trouble a lot because I talk about archangels and I never tell anyone what it is. So Lawrence, love you, Lawrence, was like, please just spend 4 minutes explaining what archangels is doing. So Paul, if you'll bring up those slides quickly, I want to build on that notion. If somebody is using the term caregiver and is familiar with it, that's awesome. Get them in your ERGs, unpack your EAPs, make sure that people are knowing that there are these resources and get them over to them. We find that when we do greenfield research out to a population that's not involved with healthcare in any way, shape, or form, the term caregiver resonates. We get about let's call it 1x as the baseline of folks will respond when we use that terminology. But we get 6.5 times that if we have something that says, are you an archangel? Click here to find out. Just an example of out of the box thinking. I think in the healthcare space, we've got to be more aspirational, more hope oriented, more celebratory while acknowledging that these things are hard. So try using different language. Paul, if you'll go to the next slide. The Caregiver Intensity Index takes about 2.5 minutes to do. And it's based on 20 years of research, the stuff that we did, Eliza, and then pivoting, I hate that term, I'm sorry I used it, to be looking at evolving, to be looking at caregivers in particular, but it looks at load, things like time, finances, family conflict, self-doubt, buffers, feeling supported, being informed, finding meaning and work support, all themes that you've been hearing all day. And then the impact, self-neglect, withdrawal, emotional distress, reactive and negative emotions, and work impairment. And it gives you an actual score, right? So on a scale of 0 to 100, you're an 80. You're in the red. And we use this language sort of like an alert. Like I'll say to Antonio, I'm in the red today. Like, be careful. I'll say to my kids, like, now's not the time to ask me that question. Come back in a week when it might be in the green. But if you look down, you'll see that it's doing something else very important. In addition to validating how somebody's feeling, this is true. We feel you, or saying, hey, it's great. Today's a good day to try something new. It's also saying, here are the two areas that you're having particular stress. In this particular circumstance, it's family and money. But these parts of caregiving are going well for you. It's such an important part of when we're doing stuff for caregivers. We have to also acknowledge this is glorious work and celebrate and help somebody get more of the things that they are doing well. In this case, it was feeling supported by friends or family or taking care of themselves, which is unusual because we know so often that's what goes. If you go to the next slide really quickly, that's obviously how it could look. When you're going through the intensity index, it's very quickly tagging you with all the things that you need the most support on. And we're very careful to say we're not going to give you list fatigue. Caregivers don't need another to-do list of 80,000 things that they've got to sort through themselves. So we'll say, okay, here are the 4 places you can go. And then we don't do those things. We partner with someone like Anna or someone like Robin to say, what do you have under your umbrella that addresses family conflict, that addresses, I need help with legal assistance, I need time with care aid, I'm having a really hard time with money overall. And so it then crosswalks people over to these resources that they might not otherwise have been able to find and can increase utilization of them as well. If you'll jump quickly to the next one, from a mobile perspective, if you just show the next one, you can see how it could look the same. Here's where you are, here are the things that you need more help on, here are the things that are going well, and then jump to the next one. I just want to make a point that for a number of caregivers, just knowing that just the process of being seen in their reality is like care. It's like a service. So if all you do at your organization is go back and start talking about, oh my gosh, I'm a caregiver and it's really, really hard, you're going to make that other person, especially a population who does not know what that term is. They're a millennial, they're Gen Z, they're like, I'm the only one. No, you're not the only one. Just that can reduce intensity significantly. And if you go to the next one, I'll just show really quickly from it starts with what does your organization have that can help? How can you start changing language as an organization to use stories, data to get folks to drive awareness? If you want to use the Caregiver Intensity Index, that's fantastic. Whatever you're doing, Chuck spoke about this in the beginning, take an assessment at a population level, but also allow people to understand that for themselves, crosswalk them to resources, and then as importantly, roll that individual perspective up so you can look at a broader level to say, what are we doing well and what we're not? This is a population of double duty caregivers, meaning they are a paid caregiver at the same time that they're unpaid caregivers. You'll see that 19% are high intensity. There was nobody in the green of this population. And then all that reporting rolls back up to saying, here are the places that is reducing load and here are the places that are increasing buffers. There, I'm done. I'm going back to you, Anna. So there's a quote, you know I love quotes. No human steps in the same river twice. They are not the same human. It's not the same river. I think probably most of us would say that's more true now than ever before, #COVID. Talk a little bit of, caregiving's finally getting a ton of attention. It's like being drawn out of the shadows. How do we capitalize on this moment right now? What is the value prop that you sell to a health plan?
I would say it's probably different for different health plans and different employers, depending on how they're sort of thinking about it. For us, I think one of the real clear connections is they're twofold. One is this is an equity issue. And it is clear when you look at the data, like the absolute, the disproportionate impact, like we have seen with COVID, like we were seeing in sort of like of caregivers of color in their mental health, it just like fully aligns with the work, announced a first phase of this a couple of weeks ago. Blue Cross Blue Shield of Massachusetts has made kind of diversity, equity, and inclusion a priority for a very long time. And we're taking the first steps of a much more expansive and broader approach with it now, from kind of first in class ways to actually capture data about our members from our accounts and from them in cells, from people themselves in online, the way that we're sort of thinking about paying incentives and like quality measures. But so it's really an equity issue. I think that's clear. I think it's also, it really aligns with our focus on mental health, which again is a 10 or 15 year commitment from Blue Cross Blue Shield of Massachusetts, which has done everything from changing the way we pay and cover and eliminate co-pays and prior auths. I mean, this is an area of focus that just has gone back so very, very long. And when you're seeing those things come together, I think from equity and from mental health and just seeing how caregivers are living right at the nexus of that, it just becomes clearer and clearer. It's a way that we need to think about these things. Again, not just because it's mental health, not just because it's equity, because it's, caregivers still need to preserve the individual identity within that. But that's where I think the dual forces of COVID are shining this light giving us this opportunity to name caregiving as its own issue and really reinforcing the other things that are going along hand in hand with it.
Yeah, and I love that, because I think sometimes a lot of people in boardrooms across the country right now are like, I need to do something about DEI. I need to do something about mental health, behavioral health. Good, do something for the unpaid caregiver, because they are flat in the middle of that. And I think the other point that we all need to remember is oftentimes when people think about innovation, they think technology, they think something that's, you know, sexy and flashy and wonderful, and that's true, often it is. But we have to remember that a huge percentage of these unpaid caregivers, think about many essential workers, not those who are in the front line from a healthcare perspective, but those who might be a cashier at a retail site. They might not have email. It might not be that when you think you're checking the box of supporting caregivers by shooting out an email to everybody that says, we have a caregiver support group, that's not getting to a huge percentage of the population. And I know, Robin, that's something that you think about a lot too, which is how do we find these non-traditional, non-privileged ways of recognizing that these unpaid caregivers, particularly those who are having the greatest impact from behavioral health or DEI perspective, you're not going to find them just by these traditional methods that work in a white collar environment, but absolutely are not finding success across the spectrum.
Yeah, I mean, I'm exactly where Anna is on this. I mean, I think this really is about equity. It's about well-being across the life cycle. It's about mental health. It's about using data to help us understand what's happening. And with that in mind, we, for the first time in Massachusetts, are going to have information on caregivers as we field a very large public health phone survey, which is done across the country. And some states look at caregivers, but we, for the first time, will be looking at caregivers so we understand who identifies as a caregiver and what some of their needs and issues are. So I think that's an important step forward. I think the other thing I'll say to kind of close this out, or to close out my portion here, is, you know, as you listen to everyone's remarks today and you think about the enormity of this challenge and the situation, it is so very clear that the collaborative structure that we're seeing today, you know, with the Caregiving Collaborative, is really all about creating an ecosystem so that we can approach this and work on this together. It's way bigger than any one sector, one agency, one organization. And so the importance of the collaboration is enormously significant.
Yeah. I want to say to both of you, I think of you as caregivers. I watch you all the time be caregivers to obviously your family, but to the people who are on your teams. And you are thinking tirelessly about how to care for the entire state. And I am so grateful to both of you, and to everyone who's listening. You know, you're all caregivers in some way too. And think about all that data. For a second, step out of your body that's attending a webinar and be in your body that is probably also a caregiver, and those statistics apply to you as well. So take care of yourself. We see you and we appreciate you. Reach out to a buddy. Let them be your red phone, maybe just by telling your own story and encouraging them to tell theirs. And MassTech Collaborative, Lawrence, I'm going to pass this back to you. Thank you, Carolyn. Thank you to the whole team. You guys are amazing at the attention and action you're bringing in very heart line, but top and bottom line ways too. And we're very, very grateful. I'm super grateful to be part of this. So thank you. Thank you.
Thank you, Alex. And thanks, Anna and Robin and Chuck. I think everybody would give you a round of applause for all the work that you're doing to support caregivers, to support all of us, and to raise awareness. One of the things that we felt was really important through the Mass Caregiving Initiative is to say, look, long-term, our goal with this is to affect cultural and policy change. You know, we have to make sure that folks identify as caregivers, that they are recognized as caregivers, that they're honored as caregivers, that they're supported as caregivers. So we are super excited to be launching the Caregiving Initiative. This is the first in a series of webinars that we expect to run every couple of months. The next webinar will be with iRobot, a great Massachusetts company working, you know, taking a look at some of the caregiver stress that they were seeing in their own workforce, and then talking about the innovation that they deployed to help support them in working with Torchlight, a caregiver support innovator, also based here in Massachusetts. A couple of quick things just as we close out. Please, please, please fill out the survey that will pop up, and we'll ask you to, that'll give us ideas on future events and future innovations to dig into in this series. We'll be sending out a note with links to the resources that were that were talked about here. Paul and Molly and others dropped a bunch of those into the chat as well. And so thank you. Take care of yourselves. Take care of your loved ones. And if you, as Robin mentioned, and as Alex mentioned, if you have a loved one in the state over 75, please take care of them by taking them to get a vaccine. So thank you all very much, and we will talk soon.